am Shalini, one of the OET aspirant from MAD OET Edu Skills. What is MAD? MAD is nothing but make a difference while practicing. Yes, dear friends, I am here to give a gist of reading test part A. We know whenever we think about reading part A, we are anxious, we are panicked. But don't worry, there are various tricks and tips that can help you to crack your OET reading skill. You know, OET reading part A has got 4 texts. Text A, text B, text C and text D. And it has got 20 questions. And these 20 questions has to be completed within 15 minutes. Please mind, the time is adequate. But remember, you need to master the skills to scan and skim. Then only you can score what you expect. So let us talk about reading part A. As I told you before, reading part A has got 4 texts. And there are 3 types of questions in part A. First of all, there is a questions such as matching the sentences. You will be given particular sentence which you have to go back to the text and compare or look which text this sentence fall into. And grab that sentence or that text and put the answer in your question. Like maybe the sentence could be from part A, then you can just write A. If it is from part C, you can write C. So and so forth. Second type is sentence completion. That is, there is a sentence given which is incomplete where you have to go to the text and look for the correct answer. Mind, my dear friends, you cannot manipulate the text what is given. Here, your medical knowledge does not come into action. The thing is, the ability to fetch the answer from the text and put it in the same way in the question. And this type of question, you have to put it relevantly to the answer. You are not even supposed to quit an article. Sometimes we have a tendency to just leave behind the article. But if you do so, definitely you are going to get what is not satisfactory to you. And the third type of question here is short answers. The questions are given where you need to put a word or a phrase. But remember, synonym plays a vital role here. So you need to know the synonyms because the exact thing will not be copied or exact thing will not be given to get the answer. Is that clear to you? Hoping that you understood what I said, let us go into the practice. I have taken a text. It is OET approved. It is an authentic source where you will get a knack of scanning and skimming and getting the appropriate answer to the question. Sit right back, relax, and let's start with the question answer session. To begin with, first source is I have taken a text. I forgot to tell you one thing. What you have to do is, you need to follow a sequence. Whenever you do the part A, remember to follow the sequence. That means you need to follow definition, clinical assessment, diagnosis investigations, medications or management, and also monitoring, prevention and complications. My dear friends, remember, any text that does not involve this kind of information, that is not an authentic source. So if at all you find it a text, you have to think what comes in which para or what comes in which text. Then whatever is there in the question, you can just go back to the particular text. That may be the definition, that may be the clinical assessment, or that can be the medications or management, or that can be the prevention or complication. So it will become easier for you. But remember, once you start the text or once you start the exam, you have to have a mastery over skimming and scanning. What do you skim? Or why do you skim? Yes, you skim the text to get the general idea. When you get a general idea, you are already fit and fine with the thing. So when you get the general idea, you know what the text is going to talk about. Secondly, you need to see that you will highlight the numbers, highlight the percentages, abbreviations, time, date, cause and effect, adjective, types, chronology, comparison and contrast, and synonyms. When you skim and scan through these aspects keeping in mind, definitely you are going to crack OET Part B in reading. So, I want to just repeat, when you skim and scan, you will get the idea of the content. You need to skim for numbers, dates, adjectives, cause and effect, contrast, and different aspects what I already dealt with. So let's start with an example. I have taken a text from the OET, that is total knee replacement. So when you get the text, remember to scan for headings, titles, subheadings. Okay? The title here is total knee replacement. That means these 4 texts will talk about total knee replacement. They will not talk about other aspects. Okay? And we have got text 1, which they talk about definition. They say total knee replacement is a surgery performed to reduce the effects of a damaged or diseased knee. That means they talk about definition. Then we have second text, that is the clinical assessment. What do they see here? They will see complete a thorough medical history, check to ensure fitness for anesthetic and rehabilitation. They will talk about here physiotherapy assessment. They will talk for the symptoms that we have to check, like severe pain, swelling, mobility, or they tell about what the thing will happen with the patient. Those things they will be talking here. So that comes in the clinical assessment. And the text 3, what we have is potential complications. In the potential complications, we have in text what I have already given in the last slide, medications, but it could be interchangeable. The complications, they will see what will happen once the patient undergoes surgery. What we need to watch for. That will be talked in potential complication. And the text 4 says about post-operative care. Post-operative care is after the operation is done. What we are supposed to do to the patient. The post-operative care also includes the pain management and also includes other non-pharmaceutical management. That all things comes in the post-operative care. Now let's see one by one. In the part A, first questions will be 1 to 7, where you need to match the sentences with the text given. So let's see now. The first one is the symptoms to check for during clinical assessment. The word itself is given. You have to mark the keyword here. What is the keyword here? The keyword here is clinical assessment. In the question, it is given clinical assessment. That means you need to look for clinical assessment. They are saying when you do the clinical assessment, what symptom you look for. So you can identify 2 keywords, the symptoms as well as clinical assessment. Where do we go to search this answer? You have to go to part B, which talks about clinical assessment. They have said you need to check the symptoms for in the clinical. In the text, it says, text 2, it says that you need to check for symptoms of physical assessment. That means when you do the clinical assessment, you check for symptoms. What is the question here? The question is the symptom to check for during clinical assessment. It is given. Here the synonym is not used. Exact word is used. Doesn't matter. Somewhere they give the synonym that you should be keen about. That's why you should put there B, because the answer, this sentence matches with the text B. So the answer is B. Second question, the timeline to full recovery. It gives in where? Full recovery, we have a separate heading there in the text 4. In the text 4, it is said, it is there, the entire column last it is given in the text 4. Yes, they are given timeline to full recovery. So you know it is given in text D. So the answer is D. Coming to third question. Smaller operations as alternatives to knee replacement. They are asking what is the other options for knee replacement. There are other options. Where we could find this? We can find these options maybe in the text A because they talk about knee replacement. In the knee replacement, they tell in there, they say that operations, smaller operations may be considered to delay the need for a total knee joint replacement. They say that smaller operations may be considered to delay the need for total knee joint replacement. What is the meaning of consider to delay? It's optional. Consider delay is there is an alternative. You can consider there is an alternative, it says. So that could be the answer. So you put it there. What alphabet you are going to put? That comes in A. So the answer is A. Next, fourth one is post-operative care following knee replacement. Already the keyword is post-operative. Post-operative is there in the text B. So what is your question? The question is post-operative care following knee replacement. So you know it is post-operative. So you put the D. Next question is potential complications. Potential complications means what are the complications? That comes in text 3 because complication, the subheading is complication. So you know potential complication. This is in text 3. Then comes the reason a patient needs to seek medical help after discharge. So after discharge, complications. So in the complications, they may be saying that, we will go back again in the potential, yes, complication. We have written there, patients are advised to seek help. That's why I underline in green ink so that it is easy for you. That comes in text 3. Okay. The next question, the last question, that is what a total knee replacement is. What is the definition? Definitely they are saying what is knee replacement. You are supposed to explain what is knee replacement. That comes in the definition. So that is in part A, text 1. So you see, we did not take much of the time. With this little span of time, we could complete 7 questions. So understanding the keywords, understanding how to skim and scan, we could achieve 7 correct answers. In my case, I did it. Earlier, before I was not into father's OET classes, I was not able to do a single task correctly. Once I got the strategies given by Father Saleen Joseph, definitely I could say that I could do much better way, and I really thankful to Father Saleen Joseph. Now coming to the next questions, as I said, it is word or phrase that you are going to fit it. But the answers will be there among the 4 texts. So let us see question number 8. What type of analgesia is administered using a patient-controlled analgesia system? See, you have to remember here, what type. They are asking to tell what type. What could be there? There could be a noun. What type? So, you remember, most of the students, we make a mistake here. The question is, what type of analgesia? And we write the answer, opioid analgesia. We are wrong because analgesia is there in the question. We should not repeat in the answer. So we cannot write analgesia. I have written it just to let you know that it is done. But remember, it should not be done. The answer is only opioid. Let me delete the analgesia. Okay. So remember, if you write the answer as opioid analgesia, definitely you are going to score 0. Why? There is given only what type. They are asked the type. Yes, they wanted the answer as opioid. Understood? So remember this. Second question. What do the initials PKR stands for? Sometimes we are in such a hurry because the heading is total knee replacement TKR. So we write total knee replacement, which is not to be done. My dear students, don't get panic. When you write the exam, be relaxed. When you relax, your mind also is relaxed. And you can write the correct answer. So my strategy to you is, be relaxed when you answer the reading. But so, the second question, what do the initials PKR stands for? So, P stands for partial, K stands for knee, R stands for replacement. So, you need to write partial knee replacement. Third question, what are the most common complications following knee replacement surgery? As we know, what we say is most, least, or majority. These are the vital words that you should remember. That means you have to focus on that aspect in the text. When they say most, as we all know, above 50% is most. Or majority means we have maximum people who have this. So when you underline the keyword as most, it's easy to track you in the text what you want to write. So what are? There is a plural. That means not single thing is important. There are two things are there which are most common complications. If they say what is the most common, then you're supposed to write one answer, one word. Because they're asking here what are. R is supposed to be more than one. So your answer should be, it is there when you go back. It is infection and blood clots. Where do you go? You go to the complication. Let us go to the complication and find out the answer. It is given there, the most common complications following knee replacement surgery is, first one is, there in the first line, that is infection and blood clots are the most common complications following knee replacement surgery. So the answer is two things. If you write only one, you are wrong. Remember this. This is what I learned by my mistake. So you have to remember, read the question thoroughly. Understand, try to understand the question so that you don't make a mistake. Because you need to score 20 out of 20 to achieve your A. And it is easy to achieve. Even if it is 15 minutes, it is very easy to achieve. So what is the next question? The next question is, during the clinical assessment, what does a physiotherapist assess? See, the keyword is clinical assessment, they are said. And there is a particular person who is assessing. It is not the nurse. They are asked for physiotherapist. So what the physiotherapist assess during the physical assessment? Let's go to physical assessment. In the physical assessment, it is therapy assessment of mobility and gait. They are not given exact the sentence what is there in the question in the text. Correct? They are not given exactly. But you need to understand. You need to understand the concept and fetch the answer from there. So physiotherapist will look for the mobility and the gait. Okay. What is the next question? The 12th question is, what is the main reason a total knee replacement is carried out for? Main reason. See again here they are given main. There may be many reasons to do the total knee replacement. But what's the main thing that we do? The answer is when we go for the main reason, we go in the text A. Because text A will tell you definition and why do you do total knee replacement. So it is given osteoarthritis is the main reason for a total knee replacement. See, the answers are right here. You need not worry. You need not get tensed or you need not be scared. The thing what is required here is, my dear friends, just the practice with the patients. Just a consistent practice with the minimum stress. Definitely you will get your desired score. For the next question, what is the minimum knee bend a patient should have on discharge from hospital? They ask minimum this much they need to bend, then only they will be discharged, otherwise no. So what is the minimum bend? So where we can find it? We find it on discharge because discharge is a keyword. So in the discharge it is written, at discharge most patients are able to bend their knee well, preferably to a minimum of a 90-degree angle. You see, you don't miss the article A. It's must. So a 90-degree angle has to be written in your answer. Next question is, during the clinical assessment, you see, when they tell the keyword is there, they have already told you during the clinical assessment, A patient's medical history is checked to ensure they are fit for what? So where it comes? In the clinical assessment, the sentence is there. Complete a thorough medical history check to ensure fitness for anesthetic and rehabilitation. You see the correct answer, because if you look for the same sentence in the text, you are a failure. Remember, you don't go to look into the same text in the sentence or same thing. If you keep on searching, you will never get it. That's why synonym plays a vital role here. So synonym plays a vital role. That means the text can be given in altering. The words may be here and there. Words may be different, but the meaning remains the same. That you need to remember. Understood? So that's the answer. Now let's go to next question. The next question is 15th one, where you need to complete the answers again with a word or the short phrase. But this is fill in the blanks. What we say? Sentence completion. Okay. So you see here the 15th question. Deep vein thrombosis prevention options include use of an intermittent. Use of an dash. The question is, deep vein thrombosis prevention options include use of dash. So you need to write an intermittent foot sole pump. So where it is there? It is there in the prevention. So prevention text is there where? It is there in the text 4. We go to text 4. Prevention, it will talk about the pump. Yes, in part B, text 2, it comes. In the text 2, they say that during the clinical assessment, we'll come down, we'll look as it is there. Deep vein thrombosis prevention options include use of an intermittent foot sole pump. Okay, but remember, if you write, if the question includes machine, then you should skip the pump. If the question does not include the machine, then you need to write a foot. So you should be very, very keen what to write and what to skip. Since you know the medical knowledge, remember, you cannot put what you know, but you need to just cut and paste what is there in the text. Always remember. Sometimes, because we have a tendency that we are thorough about the medical abbreviations or the medical terms or the medical conditions, we tend to write what we know. Never do that. Never do that. You need to just copy what is there in the text. Let's see the next question. Next question is, a person may report knee dash or clicking during the clinical assessment. See, they are told when you do the clinical assessment, patient will have something in the knee. So let us go back and search in the clinical assessment. In the text B or the part B or the text 2, we say we look for checks for symptoms of knee giving away, knee locking or knee clicking. So they have not written knee locking and knee clicking because both are related to knee. So they have given knee clicking or locking. So you have to just cut and paste from there. Don't copy the answer. When the knee is here in the question, don't write again knee. It is wrong. Don't write it. There you need to use your intelligence. Remember, there you need to use your intelligence. What's the last question? The parts of an artificial knee joint. The parts, now they are talking about part. Something particular they are about. The parts of an artificial knee joint may be held in place with the dash. Okay? They are asking with the dash. You should find out in the, we see this is knee procedure is over, right? So maybe in the text A, you can see there. In the text A, you can see something. Yeah, they are talking there. They are saying that the parts may be held in place with cement or newborn growth. In part A, they say cement. That is why we put this plaster cast and all these things. But we don't bother what we know. But we just take the word from here or the phrase from here and fit it there in the question. So it is given in the part A, that is cement. The answer should be cement. Okay, let's go to the question. Next question. Yes. Next question is on, before that, I think 17th question is finished. Yeah, over. Now the 18th question. On discharge, most patients are able to walk, dash and go up and down stairs with a walking aid. They are asking on discharge. So, before you could discharge the patient should do this. So, let's see in discharge. They have written there, at discharge, most patients are able to. They are told bend their knee well, and the second point they are telling walk 10 meters. Walk 10 meters. If you write 10, you are wrong, because you need to mention the length in units. So it is 10 meters. So 10 meters. The answer is 10 meters. And the 19th question. Dash tissue forming and restricting movement of the knee is a potential complication following knee replacement surgery. You see that maybe in the complication you can see excess. Yes, it is there. Excess scar tissue forming. Excess scar tissue forming and restrictive movement of the knee is the complication which they want you to write. So you will write excess scar formation. If you write scar formation, it is wrong because scar is normally formed. Scar is normally formed. It is a healing process. But excess forming is going to interrupt. So here we need to have our critical thinking playing in action. The last question, last question is, dash and lifestyle changes are the first choices of managing the knee symptoms. See here, there is choices. That is a choices. That means there are more than one. Okay, that you have to keep in mind. Choices. What's the first choice? It should be a single answer. Because they ask for choices, definitely there is more than one answer. So what is the answer? It gives there. It says that medication, physiotherapy and lifestyle changes are the first choice for managing the knee symptoms. So are you clear, my dear friends? So simple the OET reading part is. We will fall in love with OET reading if we practice these strategies. And definitely I promise you, if you follow the strategies given by me as well as all the aspirants or our motivator, our teacher for the Saleen Joseph's class videos, keep watching repeatedly. Don't get tired of watching and you will definitely do well in your exam. But remember, before I could conclude, I want some points you to remember. What are those? First one, exam is a situation where everybody is anxious about. But I do tell you, don't be panic. Be relaxed. Be relaxed so that you are cool in answering the questions. Second point, be positive. It is always said, there is a law of attraction. When you mix with the positive thinking people, when you talk to positive thinking people, you will be always positive. And when you talk positive, our brain is very happy to prove what you want. So try to say, whenever you sit for the exam, when you practice OET reading, tell to yourself, I can do it. I can achieve what I want. I love OET reading. OET is my passion. If you tell this in your mind and sit and start studying, definitely you will master the skills in a fraction of time. Third point, don't work hard, but work smart. Very important. Working hard is not a criteria to crack OET. You need to work smartly. It is very, very essential to work smartly. Then, keep in mind the time. We feel when we practice at home, there is enough time, we are more relaxed than what is required, and we go in that space, definitely we will be running short of time. So keep in mind that when you practice at home, try to finish your task within 10 minutes or maximum to 12 minutes. Then definitely in the exam, within 15 minutes, you can do 20 out of 20 questions complete with the correct answers. Next, don't forget to skim and scan. Remember, skim and scan is the essence of part A reading. You need to skim and scan and it should take less than 1 minute to do that. Don't waste time reading the whole text, which is not going to help you at all. Just skim and scan and see that the thing what I talked in the previous slide, what to skim for, what to scan for. Keep it in mind and do it. Definitely you're going to score what you want. Master the synonyms. It's very simple. How do you master the synonyms? No need to go for the dictionary. No need to go for the mass media. When you practice at home your OET reading, keep a paper and pen aside and jot down the words which have a synonym. The different words, the unique words, the unknown words, what comes into the practice. Write down, find out the synonym for that and learn, and you will have a synonym book with you which will help you at your difficulty. Then practice in bits but consistent. Don't take lot of efforts to study part A, part B, part C, part D, reading, writing. Don't do it, because once you're exhausted, your brain will say, stop, I cannot do anymore. Don't strain your brain. Do it part by part and be consistent. Today you are done, 2 days you sleep. No, don't do that. You do consistently. We say slow and steady wins the race. That point, if you remember, my dear friends, I guarantee you, you will be the topper in OET and you will bring laurels to your loved ones. Last one, do your best. Leave the rest to God. Everything what is happening, I know my personal experience, it is by the will of God. I firmly believe whatever so far has happened in me, it is because of the will of God. But we need to put our efforts and the rest leave it to Him. If He likes it or if He feels that you deserve it, definitely He is going to give you. So, to summarize, again, I will tell you, OET reading part A, which is the most interesting part in reading. It has got total of 20 questions and the task is to finish within 15 minutes. And the task are, the questions are of 3 types. We have sentence completion, we have matching the sentences, and we have word or phrase answers, short answers. Then also to remember, in the OET reading, you need to remember to skim and scan, and you need to find out the keywords, and you need to find out these synonyms. Remember, my dear friends, OET is not testing your knowledge on your medical or your professional content, but they want to find out how well you could pick up the apt answer from the text, understanding the meaning of the text. That's all for today. Have a nice day. Please don't forget to like and subscribe our videos. We will be coming up with the new videos. If at all you have any queries, please comment it in the comment box. We'll appreciate your comments and we will try to do justice to all aspirants, those who are waiting to learn OET from EduSkills. Thank you.